All right. BQ1 COVID variant becomes increasingly prevalent in the U.S. infections, according to the CDC. Ugh. All right. A new subvariant of the Omicron variant of the coronavirus is becoming increasingly prevalent in the United States, according to data from the Centers for Disease Control and Prevention. CDC data shows that BQ1 and BQ1.1 variants each make up 5.7% of the total number of cases in the country in the past week. The BA5 subvariant, which has dominated the cases in the U.S. for months, made up 67.9%, down from its peak in late August when it made up almost 90% of all cases in the country. BQ1 and BQ1.1 variants have increasingly spread in recent weeks, only trailing the BA5 variant and BA46 variants in making up the most cases. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, and President Biden's chief medical advisor, told CBS in an interview that people need to keep an eye out for emerging variants, despite cases and hospitalizations being down. Keep an eye out. Yeah. Fauci's got our backs. All we gotta do is keep an eye out, for the microscopic virus. Damn, yeah. I don't know why anyone didn't think of that. Just keep an eye out. When you're going to the grocery store, keep an eye out for the microscopic virus. Keep your eyes peeled so you can spot its genome, so you can tell what fucking version it is. What the fuck does keep a fucking eye out fucking mean? Jesus fucking Christ! When you get variants like that, you look at what the rate of increase is as relative proportion of the variants. And this has pretty troublesome doubling time. Oh, wow, okay. Keep a fucking eye out. Jesus fuck. Oh, Fauci said he is worried that the subsequent variants may be more effective at evading medications than scientists have developed and help patients manage the virus. I read that a lot of, the antibody shit, all of that, I read that does not function properly, or at least as well, nearly as well, with these new variants. There's some info that's come out of the UK on this one. That's the reason why people are concerned about BQ 1.1, for the double reason of its doubling time and the fact that it seems to elude important monoclonal antibodies. Cases and hospitalizations have dropped since July, and deaths have been increasing since August, but health officials have warned the public to expect an increase in cases as winter approaches. Talking about the booster, I got this other article here. The best thing you can do to quash a deadly COVID-19 surge this winter. I love how this is from Vox. This is in the previous article is from The Hill. But I love how this is hot tip! How to make your pasta not stick to the pan and 5 easy steps. This is the messaging campaign we have in this country. Once again, let me reiterate. The only time ever in any of our lifetimes in U.S. history that we've got free, universal, effective healthcare against one of the most deadly things in this country, and it's not the government telling us, giving us mailers, sending us alerts. It's news articles giving us hot tips. Oh, this is a TikTok. Top 5 ways to keep your leftovers in the fridge for an extra day. What? Oh. Another winter, another wave. With the leaves changing color, temperatures dropping, and people spending more time indoors, health officials are warning of a spike not just in COVID-19 cases, but other infections as well. The challenge with holiday seasons every year is also a time when contagious respiratory viruses like influenza, RSV, and again this year COVID spread much more quickly, said Ashish Jha, the White House COVID-19 response coordinator, during a press conference on Tuesday. COVID-19 cases are already rising in Europe, a trend that has preceded waves of infection in the U.S. in the past. The key question is just how deadly will COVID-19 be this winter? Jha said the COVID-19 is not the same disruptive threat it was in the past 2 years. It's likely that cases will increase again, but that they won't cause the towering spike of hospitalizations and deaths experienced last winter, which were fueled by the Omicron variant of the SARS-CoV-2 virus that causes COVID-19. In January, more than 2,000 people per day died from COVID-19. Currently, about 300 people are dying every day in the U.S. from the disease. Y'all, I am losing it with this fucking country. I just want to examine this quote here. Like, just fucking, like, I hate Americans. Like, all of them. Every single, I hate this country, right? 1, I hate this country. 2, I hate the people that live here. My neighbor down the street, everyone in this country, I fucking hate them all. The society that we've developed, this so-called civilization that we've developed, is so fucking goddamn garbage. It's garbage. The challenge with holiday seasons every year is that it's also a time where contagious respiratory viruses like influenza, RSV, and again this year COVID spread much more quickly. Like, as a society, Americans, and humans, right, but Americans, are so fucking stupid that they don't wear masks on planes or travel in any way, right? And then, for whatever reason, we all decide it's the holiday, you gotta go see the family, it's Thanksgiving. So everyone's flying around without masks on and spreading deadly viruses every year. Like, it's baked in. Yeah, 30, 40,000 people will die of the flu every year. It's mostly because of flight. It's mostly because of Thanksgiving. It's mostly because of Christmas time. People flying all over the place, spreading the flu. And that's just part of normal life. That's just normal life. Americans are so fucking goddamn stupid that we're okay with 30 to 40,000 people dying every holiday season from the flu or something, just so we can get to fucking Thanksgiving to hang out with our stupid fucking family and eat a bunch of stupid fucking food that we don't even like doing anyway, but we do it fucking anyway because we're programmed by fucking society. Oh, it's Thanksgiving, gotta go with the family. What? Like, I'm just like, what? Like, I don't know, man. Who fucking thought about this shit? Has anyone stopped and just thought a little bit about, like, I don't know, a better alternative? Like wearing a fucking mask on the airplane so that fucking thousands of people don't die every year from the fucking flu? You know what I mean? Like, what the fuck? Why are Americans so fucking stupid? Anyway, it's just a fucking sidebar. Let's get back into this. What's changed is that far more people have been vaccinated and exposed to COVID-19 by now, so basically no one is seeing the virus for the first time at this point. Hey, I just want to say this. I have not gotten COVID-19, so I have seen the virus 0 fucking times. So fuck you, Justin Lessler, you little prick. Professor at the epidemiology at the University of North Carolina who develops COVID-19 models. That means most people have now seen some degree of protection against the disease. That's not what it means, which lowers the likelihood of dying from it. That is not true. I'm telling you this right now. If you got COVID in fucking July of 2020 and BQ 1.1 is staring you down the fucking barrel, like, it doesn't matter. I'm telling you this. It doesn't matter. It, like, this, like, oh, I got immunity. It's not like, if the virus didn't mutate, maybe, right? But, like, it's not a thing, man. It's not a thing. But that's not enough to absorb another wave of misery. Protection from COVID-19 exposure or vaccination fades over time. Some groups, like older adults and immunocompromised people, remain at higher risk of severe illness and death from COVID-19 even with vaccines. The virus itself is continuing to change in ways that make it easier to spread and harder to counter. And while most U.S. adults have received at least 1 dose of a COVID-19 vaccine, like, why are we doing this? Why are we talking about things like this, man? Someone getting one dose. If someone got one dose, when would they have gotten it? I don't know, April, May 2021? If they only got one dose. Someone getting one fucking COVID shot? Like 19 months ago. 19 months ago, that's not a thing. That's not a... That... We know that the vaccines wane over time. That's why we need booster shots. Someone getting a fucking shot 19 months ago, half a dose, by the way, because the initial series is 2 shots, right? So someone getting half of their initial series fucking 19 months ago, that's not a thing. That doesn't matter. That doesn't matter. That is irrelevant. That's like saying, well, you know, I don't know how I could be diagnosed with diabetes. I ate a salad about, what was it, year back, 2 years back. I went out to the Cracker Barrel and I thought of my, you know, there was a coupon for a free big salad, and I was thought to myself, so I don't know how it could be that I had diabetes when, you know, again, year maybe 2 back, I went to the Cracker Barrel and got a big salad. So, you know, it really doesn't make sense to me. Like, what? What? One of the biggest factors shaping the course of COVID-19 is within our control. Is it? Is it in our control? Or is it in the control of the average American? Is that who's in control? Am I in control? I'm not in control. You know who's fucking steering this ship? You know who's in the fucking driver's seat? The average shit for brains, stupid fuckface, dumbass fucking motherfucker American. That's who's in the fucking driver's seat. I'm not in control. No one I know is in control. But the average dunderhead Neanderthal genes being shown in high fucking cases, right? These motherfuckers are the ones driving this fucking ship. I'm telling you, man, it is not in our control. We have no control over them. They are wild fucking animals that fuck our shit up on a daily basis, the average American. They're like fucking termites. They're like fucking cockroaches. They're all fucking garbage. They're stupid. They're fucking uneducated fucking morons. They're fucking poorly hygienic. They don't know how to fucking eat properly. They don't know how to take care of themselves. And we have to fucking get their stupid fucking goddamn laboratory diseases that they want to spread to us, these fucking stupid-ass scumbag fucking bitch fucks. Anyway, Centers for Disease Control and Prevention recommends that all people over the age of 5 get a booster dose of a bivalent COVID-19 vaccine. Once again, this is an updated vaccine that is more specifically tailored to the new variants. You getting half of your fucking series 2 years ago is irrelevant. Irrelevant! You need to get the bivalent dose. It's fucking free! It's free! Like, what? It's free! It's free! It's free! It's free! It's free healthcare! It's free healthcare! Boosters ramp up immune protection and reduce the likelihood of severe COVID-19 cases. The problem is that few people are getting boosted. Almost 80% of the U.S. population has had at least one COVID vaccine dose. Doesn't mean anything. Getting one dose 2 years ago doesn't fucking mean anything. Doesn't mean anything. It doesn't mean anything. 80% of the U.S. population is irrelevant. You know what else I can say about 80% of the U.S. population? I could say 80% of the U.S. population are fucking stupid. I could say also this. Did you know 83% of kids under 18s have gotten COVID at least once? So, throwing that out there. Yet, since regulators gave bivalent boosters the green light last month, less than 4% of eligible Americans have received the new shots. In other areas, I read 10%, but I've read anywhere, like, I don't know. Is 4%? Is it 8%? All I know is the highest number I read on getting the updated bivalent booster shot is 10%, and the lowest number I read is 2%. So, we're fucked. I don't know what else to tell you. Like, we know it takes like 2 weeks, right, for the vaccine to fully take effect and to reach maximum efficiency. And 4%, according to this data set, 4%. Free. Universal healthcare. Free universal healthcare. It's free. It's universal. Everyone gets it. It's healthcare. It's effective. It's free. It's free. It's fucking free. It's free. I don't... Like, what's the fucking phrase here? Like, you can, like, fucking, like, herd a camel to water, but you can't make him drink or some shit? Like, what the fuck, man? I don't know what else to say at this point about fucking Americans. It's free. Free. Universal fucking healthcare paid for by the government, and only 4% have gotten it. It's free. It's free. It's free. Like, am I crazy? Am I the one going insane here? Like, am I the fucking freak? It's free! It's free! Universal fucking effective healthcare! It's free. It's free. It's free. And Americans are like, nah. It's free. Like, what else do I need to say? Like, what else is necessary for me to say at this point? Other than, it's free. It's a free shot. Look at this. Projected death. What is this like? Is this like daily, weekly? I don't know. I guess it's daily. I don't know. Actually. So, baseline. Vaccination continues at current daily rate. Scenario 1. Flu-like vaccination coverage of booster eligible. Now, this is the one here. Scenario 1. I went into this a little bit ago. What kind of crazy motherfucker... Like, this is apparently a thing. What kind of motherfucker gets a flu shot? You know, one you have to fucking pay for. A flu shot. You have to pay for it. What motherfucker gets a fucking shot you have to pay for, but says no to the free one? Because apparently that's a thing. Oh. This is death. This is a death chart. This axis is death. This is time. Anyway, just wanted to do a little COVID update. You know, what a world. I'm speechless, man. I don't know. Americans, they will never cease to amaze me. These fucking morons. Like, what do we do? What do we do about this? Does anyone know? Does anyone know what we do at this point with these Americans? How do we fix this? What do we do? Like, is there anything we can do? Is it all useless? Is it a waste of our time? Like, what do we do about this fucking dumb shit for brains population that we got called the United States of America's fucking population? what do we do with these motherfuckers, man? I don't. I'm losing it. I'm losing it with these motherfuckers.